Okay, so we can go ahead and get started. I imagine that we'll have some folks still trickling in as our hour goes on, but want to be respectful of everyone's time. So thank you everybody for joining us. My name is Sabra Inkner, and I'm AMCHP's Associate Director for Clinical and Community Collaboration, and one of the AMCHP staff who works on AMCHP's collaboration with NBDPN, the National Birth Defects Prevention Network. Several of my colleagues you will be hearing from today, and I will let them each introduce themselves. And we also want to shout out to our colleagues from the National Birth Defects Prevention Network. I see a few of the board members and other members are on, so we're really excited to have everybody join us. And Justin, next slide, please. So just a quick agenda, welcome and introductions. We pretty much just did that. If you all would like to introduce yourselves in the chat, that would be awesome. Just who you are and where you are from would be great. So we just have a better understanding of who is joining us today. And we're gonna, Justin's going to talk about the recent landscape analysis that AMCHP did, and then the findings from that. Paige is going to introduce our upcoming technical assistants. Noelle is going to talk about AMCHP's Innovation Hub. Brittany is going to lead us in a short peer sharing opportunity, and then we will let you all go on your way. So next slide, please. So first, we want to, as always, thank CDC for their support for our activities. And as you are all familiar with this kind of funding statement, that nothing anybody says represents CDC or anybody ever. And on that note, Alicia Dunacek, right? Yes, Dunacek, all right, is gonna kick us off here.
Thanks so much, Sabra, and good afternoon, everybody. Just wanted to say a quick hello from CDC. My name is Alicia Dunacek. I am a health scientist on the National Surveillance Team in the Birth Defects Monitoring Research Branch here at CDC. Over the past year and a half, CDC has partnered with AMCHP to strengthen the relationship between Title V, maternal and child health, and children and youth with special health care needs, SHIN programs, and then birth defect surveillance programs to identify and implement workforce capacity building activities to achieve our shared program goals. We want to identify best practices for referral, to build an evidence base of what works and what doesn't work, and to also provide national guidance and support to state partners on referral to services, best practices through educational opportunities, technical assistance, and the establishment of policies that bring Title V SHIN programs and birth defect surveillance programs into more intentional alignment. Today, I'm really excited for you to hear some high-level outcomes of the landscape analysis on alignment for all of us to learn how these outcomes can be made more actionable as well. Our hope is that the technical assistance offerings described in today's presentation will be of use to you and that you won't hesitate to use them. I'd like to thank the programs who contributed to this landscape analysis and thank AMCHP and our speakers for their hard work gathering information from the programs and developing technical assistance opportunities that you will soon hear about. And then also I wanted to thank NBDPN for their contributions throughout our partnership with AMCHP. We hope this webinar is helpful, and again, that the technical assistance opportunities come in handy in months to come. Thank you so much, Sabra. Back over to you.
All right, thank you, Alicia. And we are also excited about all the things. So with that, I am actually going to toss it over to Justin to discuss the landscape analysis. And again, as folks, I appreciate that introducing yourselves in the chat, which is awesome. Also, if you have questions, please do go ahead and put them in the chat. And if you want to ask a question that you don't want to put publicly in the chat, you can feel free to directly message me if you would like.
Okay, hello everyone. My name is Justin Huang. I am a program analyst here at AMCHP, and here to describe what some of the work that we've been doing over this last year. So the survey and our other mechanisms, the key informant interviews and the focus group interviews, all three were geared towards achieving a better understanding of the activities and functions of Title V programs, which include MCH and SHIN, and the BDS birth defect surveillance programs regarding birth defect surveillance and data. And we were hoping to obtain kind of like a cross-sectional view of how individuals view the level and quality of collaboration between their respective Title V and BDSP teams. So there were two different sets of, there we go. There were two sets that were almost run in parallel of online surveys that were sent to 128 staff from both the Title V MCH and SHIN programs and the BDSP programs. Overall, there were 63 respondents in total. So 30 from SHIN and the 33 from the BDSP programs. And then there were, 23 respondents that volunteered for key informant interviews, 6 of which were actually scheduled. And then there were 26 respondents that volunteered for the focus group interviews. And we had two different sessions that were scheduled, five-ish people participating in each one, so 10 total participants. There is more breakdown of some of the different types of case ascertainment styles for birth defect surveillance programs included here, and some of the well, just like a breakdown of the programs that responded for SHIN and MCH. And then there's another slide here for the birth defects surveillance programs that responded as well. I believe we're going to be sharing these slides with everyone afterwards, so you're more than welcome to take a look at them after, or during questions, I can always come back to these slides if you'd like to take a closer look as well. Here's a little bit more about some of the stuff that I also highlighted already, just the overall respondents for the key informant interviews and the focus group participants. There is some additional breakdown for some of the Title V folks of the different regions that ended up responding as well, both from separated out Title V and the BDSP. So some of the key findings that came out of the survey and all the interviews was that both sides agreed there was more collaboration between the two groups, although, sorry, not more collaboration. They agreed that there was collaboration between the two groups, but the ranking levels kind of differed, with Title V respondents perceiving slightly more collaboration than the BDSP respondents. And some BDSPs indicated less involvement in the reporting and advisory committee meetings. And there were also slightly more Title V respondents that were satisfied with BDSP collaborations, but there wasn't really a wide difference between, birth defect surveillance programs and the Title V program respondents. One important note is that about 32% of all the responses from BDSPs and then 26% of all the Title V responses indicated uncertainty about the overall level of satisfaction, and that could potentially be due to how new they were to their roles, or maybe they're on the staff, but they're not necessarily involved in those conversations of collaboration across the two agencies. And then if we move on to the overall recommendations, these are some of the recommendations that came out of what we heard from the survey and from the interviews. And a lot of these, well, I think most of them don't come as a surprise. That first one there, work to increase funding and staffing capacity. I guess one caveat would be respondents here expressed a desire to better understand how birth defect surveillance data might be better utilized to inform something like state performance measures for the block grant reviews, and maybe lead to allocating more funding for surveillance activities specifically. The second point is increased information and data sharing. Also is not a surprise because there's lots of siloing that happens in general. While there do seem to be established ways of sharing information and data, it's difficult to tease out just what's creating those silos without jurisdiction specific details, okay? And then from the next four, I believe, 3, 4, 5, and 6, strategically co-plan how data can inform actions, increase and support specific data to action collaborations, increasing frequency of intentional collaboration, and then beginning to explore like lifespan data surveillance, how that can occur. For those four, and really I'm just going to say for the first 3 through 5, an emerging sentiment that seemed to come out was that surveillance data is just that. Like, how many cases of X did we see last year, or what are the prevalence rates for Y condition? But beyond statistics and data reporting, the surveillance programs can be involved in planning or implementation a little bit more. And some of the questions that came out was like, how could Title V programs or birth defect surveillance programs intentionally, involve each other and coordinate with each other to plan some of these overall recommendations? Based on the survey data, and much like Title V programs across the country, each individual BDSP often operates slightly differently from the next. So any AMCHP technical assistance that's provided would likely require, again, jurisdiction-specific program-level involvement. And then the last note here, or for these 4 points, is that while co-occurrence or prioritization isn't impossible for these 4 recommendations, it might be more beneficial to see sufficient progress in the first 3, the co-planning data to action calls and collaborations, before lifespan surveillance efforts might begin. The last one, increased visibility of supports from national partners. So AMCHP currently houses a compendium of MCH practices and policies from various Title V programs that we support, and it's in the Innovation Hub database that you'll hear about in a little bit as well. So we're encouraging and happy to provide some assistance for any submissions, especially if there are any that are any existing examples of collaborations between BDSPs and Title Vs. And I believe with that, I can pass it on to some more of our TA offerings that Paige will talk about here. Thank you.
Awesome. Thanks so much, Justin. And hi, everybody. My name is Paige Fallion. I'm the Associate Director for Child Health and Children with Special Healthcare Needs at AMCHP. So I've put a few suggestions here on the slide, but I'm just going to talk through a few opportunities that are coming up that we want to make sure everyone's aware of, so we can support you in continuing to strengthen collaboration between Title V Children with Special Healthcare Needs programs and BDSPs. So first, I just want to share a little bit about what our Children with Special Healthcare Needs team does and our connections. So we have a what we call our Leadership Institute for Children with Special Healthcare Needs Directors, which has something that we've been supporting for many years now, which is basically a community that supports any workforce and TA needs that the Title V Children with Special Healthcare Needs Directors have. So I say that just to let everyone know, especially those in BDSPs, that we have really great connections and first name basis connections, especially with the Title V Children with Special Healthcare Needs Directors. So, one really kind of quick TA offering that we could offer is, if you maybe aren't as connected with your Title V program and you want to start having those conversations, or maybe there's been turnover either in the BDSP or Title V program, so you could need a sort of new connection. Those are things that we can help with, and we'd be more than happy to support that. A little deeper than that, though, there's ways that we could do, peer discussions around some of the topics that Justin just presented from the data. I think, again, if you've seen one Title V Children Youth Special Healthcare Needs program, you've only seen one, as well as with BDSPs, right? So it varies so much by jurisdiction. So we want to make sure that, we can offer not just individual, but also group TA offerings as applicable, because we want to make sure that you have the opportunity to talk with your peers, hear about what's going on in their programs, but it's also really important to understand the individual differences that exist, and the structural differences, right? So again, we're pretty keen to some of those differences, and I think the data that Justin just presented on has also helped us really understand a lot of those unique differences that are across jurisdictions. So, hopefully we can, provide the support that you need at not just an individual level, but also a group level, so that the fostering really those peer connections. One other thing that I wanted to specifically mention, which is a AMCHP resource that's going to be coming out in the next few months, is we've really been looking at how to strengthen the Title V and Medicaid Interagency Agreement, or MOUs, to really develop health equity focused work. Specifically thinking about how do Title V programs utilize their interagency agreement with Medicaid to really reflect that commitment to advancing health equity across programs, and specifically how I think this relates to the BDSP conversation is related to data. And a lot of Title V programs have data sharing agreements with their Medicaid programs, but sometimes it's just that, it's just an agreement to share data, but not going further from there. And so I think going back to what Justin just mentioned about, there's all this data, we're sharing data, but how are we using it? How are we using it to advance health equity? So again, really like some really cool specific opportunities in the future to dive into that and potentially use the Title V interagency agreement, or maybe exploring, a Title V and BDSP interagency agreement, or MOU, if one doesn't exist. So I don't want to spend too much time because I could talk all day about all this great stuff. But so I want to now pass it on to our Innovation Hub team for a presentation. And, please continue to use the chat if you have any thoughts about what we just mentioned around TA. And definitely this is only the start of the conversation. Thank you. I'll turn it over to you, Noelle.
Hi, everyone. My name is Noelle. I am part of the Evidence and Implementation team here at AMCHP. And I'm just going to talk a little bit about Innovation Hub and all it has to offer. It has a lot of benefits, and I think you'll all be interested in hearing about it. So Innovation Hub is an online platform that provides MCH professionals and advocates with resources and tools to explore, build, and share effective work grounded in evidence. And it contributes to improving the health and well-being of MCH populations in their communities. Innovation Hub houses a lot of different things, ranging from the MCH Innovations Database, which has best practices and policies. Policies were just added in fall 2021. But these are things that we see are working in the MCH field. Something really unique about it, I think, is that there's an emphasis on community-based evidence, as opposed to maybe we try to keep it a very broadly defined evidence. If every community has different bases for their work, and I think that's really cool that the database takes into account. So we have a lot of practices and policies in there. But the Innovation Hub also offers several TA opportunities, including the Innovation Hub Learning Community, which I'll talk about in a little bit. But aside from that, we have replication projects, submission support for the biannual review, and general technical assistance. Next slide. So the AMCHP Innovation Hub biannual review happens in the fall and in the spring. We accept submissions for practices and policies, and they're assessed along a continuum and added to the database. And we're always accepting referrals for this. And that's how we grow our database. We have folks involved in MCH come in, review the practices, give their feedback on it. So it's continually growing, something that we try to have new practices from all over the country in there, and it's available to the public so anybody can view it. There are things called implementation handouts that provide a little more detail into the practice. And we think that's a great resource to have for folks that are looking for maybe new kinds of strategies to incorporate into their work. We also have the replication projects, which is an annual project 4 organizations are awarded and supported in a year-long project focused on replicating a practice from the MCH Innovations database. So we work with them to adapt it to fit their own setting. We also pair them with a coach from our team, as well as a coach from the practice they're choosing to replicate. So they get that one-on-one kind of support so that their work in their setting can meaningfully adapt like whatever it was they chose from the database. We're actually in the middle of that right now. We're in the early stages of folks calling in to see if they can apply for it, to see what their best fit would be. And I'll drop the email afterward in case anyone is interested in that. And then the other piece is general technical assistance. So this is just to increase the capacity of states and jurisdictions to optimize the use of evidence to shape and champion effective policies and programs to achieve health equity. And this is offered in a variety of ways. Usually we'll have folks reach out to us and tell us what it is that they might need help with. A lot of them come from the innovations database, folks that are in there that are looking to either move up the continuum or have a question specifically about maybe their submission form, things like that. Next slide. And so we are launching this week the Innovation Hub Learning Community, which I mentioned on the earlier slide. And basically, this will be a learning community that will offer programmatic support to all practices in the MCH Innovations database through one-on-one tailored coaching, didactic webinars, and peer sharing opportunities. So with this learning community, we're hoping to build a network for participants that is responsive and kind of centers around their programmatic interest and needs. We'll have spaces for peer sharing so that participants can discuss their challenges and maybe hear from others who have went through the same thing, co-create solutions, and kind of just provide feedback on their experiences moving through their programming needs. We'll offer learning opportunities to boost participant confidence in using evaluation and implementation principles and tools. And hopefully we'll be able to support Innovation Hub practices to resubmit their work to the MCH Innovations database and move up the practice continuum. We do have 4 designations, and our goal is that everyone, with feedback and continuous support can move up their way to the best practices. I want to say something on the slide is cutting out, but we do have a webinar planned for February 23rd. And that'll come out, all that information will also come out with our official launch this Wednesday. And with that, I'll pass it over to Brittany.
Thanks, Noelle. Really, I just wanted to take a pause before we get to some peer sharing and see if there were any questions from anything that popped up from Justin's portion talking about the findings, or Paige talking about our some technical assistance opportunities at AMCHP, or Noelle sharing about Innovation Hub. I know there's been a little bit of questions and answers happening in the chat, but just wanted to make some space before we share if there are any other follow-up questions or clarifications from anything that my colleagues shared. If not, we can move along to some peer sharing, and you can stop sharing, Justin, and I will pop these in the chat as we go. And so building on a lot of what my fellow AMCHPers have shared, we really just wanted to, yes, and feel free to shoot an email to any of the email addresses that are popping up in the chat from the AMCHP side if you do think of something after the fact or want more information about what was shared. But we just wanted to clear a little bit of space in the spirit of thinking about what the Title V SHIN collaboration looks like in the birth defect surveillance program space, to think about what has worked well or what challenges you all are experiencing on the ground and related to what that collaboration and that partnership looks like. So we just have prepared, oh wait, we have a question pop up. Are there any programs related to birth defect surveillance programs in the Innovation Hub currently? I'll pop that over to one of the evidence and implementation folks.
Do you want me to answer it on the call or just in the chat?
Either or.
Okay, so I think we do have some related to birth defects and some are kind of like survey based. So I can't answer, there's a lot of practices in the hub. So I can't answer directly to exactly surveillance per se, but we do have some related to birth defects and infant health in there.
Yes, yeah, we are definitely hoping as part of this call to promote and use you all to gather some additional practices that would be specific to the birth defect surveillance program space. So feel free to reach out if you email the evidence at amchp.org. They may be able to provide with a little bit more individualized support in terms of what type of practice or what type of evidence you're looking for, and definitely would encourage you as well to reach out if you do have something that we'll talk about in peer sharing that is working really well, or a really cool strategy that your jurisdiction has developed to help foster that partnership and collaboration. So
I'm gonna pipe in with one comment there, which is the thing that you're doing is cool and we want to know about it. I think having worked in a state Title V agency, a lot of times you do what you do and you don't even realize that like maybe other people don't do that thing, right? And so you know, we really want folks to you know, the burden of like getting into the Innovation Hub is just going down and down and down. Noelle and team have made it much easier, really simple. The NBDPN AMCHP team, like we, you know, the folks that work on this project from AMCHP will be happy to provide assistance in submitting any applications. Like we really want all of you to consider submitting something, especially those of you who, if you know who your birth defect surveillance people are in your Title V program, or if you're a birth defect surveillance program and you know who your Title V SHIN people are, that is not universal, right? And so we really do want to get that information and that that into the Innovation Hub so that folks can learn from each other. So yeah, there's nothing that is too, well, my thing's not cool enough or my thing's not big enough. It is. To consider for this. So back to Brittany.
Could I also add in, and maybe Noelle forgot that she helped me do this, but we did try and do a bit of review in the Innovation Hub and listed a few that were closely related to birth defects and surveillance, but none of them specifically were birth defects surveillance program specific. This is our blog post that I just put into the chat for Birth Defects Awareness Month. And at the very bottom there, you can see a couple of different Innovation Hub practices and policies that are there that we thought were closely related. So you can see that that's what we've got so far.